So finally, we are at our final session. We will be talking about how tech is improving mental health. The moderator for this session is Choi, who is the co-director of external relations for our club, Agents of Tech, and is a computer science student. So I would like to pass this time over to you, Choi.
Yeah, thank you, Asher. Good day to everyone present here today. So I'm Choi, as introduced by Asher just now, and I always have an interest in other fields, and one of them is actually psychology. And hence, here I am moderating how tech is improving mental health, hoping to learn more from our speakers. And please understand that the conversation we are going to have has an objective of allowing the public to raise awareness on mental health and how technology is helping in tackling this issue. There's no intention of pinpointing any parties, and questions asked are solely for the purpose of enabling us to understand the real world problems. Without further ado, let us start with introducing our beloved guest speaker. First up, we have Sharumaty Jeganathan. Hi Sharumaty, great to have you here with us today. And
Hello.
do introduce yourself.
Hi, everyone. I'm Sharumaty. Y'all can call me Sharu, and I'm a second-year computer science student. I am happy to be here. I am happy to contribute and advocate on mental health, as I'm also like Chanin. I also have a huge passion, not only psychology, but especially mental health. And I have been doing a lot of mental health projects with other clubs, blah, 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 blah. So yes, happy to be here and be a part of this session. Thank you so much, AOT, for inviting me again.
Thank you, Sharon Marti. And then next up, we have Claris from Taylor's Connect. Claris, do introduce yourself to our audience here today.
All right, thank you, Choi, for that. So to everyone here today, my name is Claris and I'm the secretary for Taylor's Connect. And regarding my education background, I'm currently a second-year psychology student, hence the suitability of me being a guest speaker for today's session and guest. And also recently, I've been having a keen interest in technology, especially the metaverse and IoT and stuff like that. So yeah, thank you, AOT, for inviting me.
Thank you, Claris, and not forgetting Mingy from Taylor CSI, which stands for Community Service Initiative. Hey, Mingy, do tell us more about yourself.
Okay, thank you, Choi. So my name is Ming, and I'm currently studying Bachelor of Science in Architecture. I'm in my first year. So recently I've been quite interested in mental health topics, and I'm looking forward to have meaningful discussions with my panelists.
Okay, thank you. And to all these three speakers here today, feel free to use the raise hand feature if you have something to add on to the question asked, even though if the question is not directed to you. So to kickstart our session, let us start with the general understanding of mental health. So I believe most of us here are not strange to the word mental health, but again, not all of us have a very deep knowledge on this topic. So what exactly is mental health? And can you guys tell us more about the common and uncommon mental disorders that are existing in the society? Maybe you can start with Sharu, followed by Claris and then Mingy.
All right, okay. So I can go very definition based, but instead of that, I leave that to the rest of the speakers. Instead of that, I think I will give an understanding how I understand it and how I think it'll be easier for us in simple words. So basically, mental health is a well-being of our state, and whether how good or how effective we are coping with daily activities. Like we've got so many things that we are part of every day. We have to wake up, and in a day there's like a million decisions that we have to make. There's so many things we have to go through, so many obstacles, so many like for us there's like exams, tests, quiz, assignments, etc., etc., etc. So mental health is basically a way of coping and while ensuring our effectiveness of the overall work that we put in. So and like you said, common and uncommon disorders. First off, the basic ones, I mean the common ones, depression, anxiety, and then we've got behavioral children disorders, etc. And then we also have the uncommon ones, which is not really uncommon, but I think among at least young adults and among people of our age, I don't think there's a lot of this going on, but there is eating disorders, there is paranoia, there is OCD. I know it's very common for all of us to look at someone who's very organized national and then say, oh, you've got OCD. So many people have said that to me as well. But being organized is just a way of coping with my anxiety. So, there's a lot of things about so many different disorders that we don't really actually know. In fact, I myself don't know much about OCD, but I have been told by many people that I've got OCD. So yeah, those are some of my insights based on that.
Yeah, thank you so much for sharing, Sharu. And then perhaps it's your turn, Claris.
All right, I like how Sharu make it very layman understanding, and I like how she pointed out of the use of psychological disorders as descriptions. Like what she mentioned, doesn't mean a person is organized, doesn't mean that person has having OCD, and that is unfortunately being quite widely used today, like among the internet and stuff like that. So once again, like to clarify mental health, like in the formal definition by American Psychological Association, so mental health is really a state of mind characterized by emotional well-being, good behavior adjustment, relative freedom from anxiety and disabling symptoms, which means that you are able to function daily and in your academic wise. And lastly, a capacity to establish constructive, meaningful relationships and cope with the ordinary demands and stresses of life. So yeah, I'm going to be very mouthful in terms of definitions because I'm a psych student here and I'm pretty sure my lecturers will like remember all your definitions. So yeah, so when it comes to psychological disorders, right? So the DSM-5 listed the 3 criteria of psychological disorder, which is psychological dysfunction. Next is distress or impairment in functioning. So functioning is daily functioning, occupational functioning, or education. And lastly, the third factor is atypical response. So atypical response is very subjective because for us, what is normal to us, like Asian cultures, that we take out shoes before we walk in is normal. But for maybe the Western countries, taking off your shoe before entering the house is seen as atypical. So yeah. And regarding the commonalities of mental disorder, I think most of us would commonly hear like anxiety, depression, but really the commonness of it is very subjective. It depends on the prevalence of the mental health, the prevalence of those psychological disorders in respect to those countries. But to make it very simple, uncommon psychological disorders that are not really well understood will be personality disorders. So one of it will be OCPD. So you guys know OCD, but OCPD is a personality version of it. Yeah, that's all from me.
All right,
So-
thank you. Oh, sorry. Thank you,
sorry,
Claris.
it's okay.
And then now it's your turn, Mingy.
Okay, I think for me, in simple terms, mental health stands for psychological and emotional well-being, and also the common mental disorders that we can see nowadays, as mentioned by Sharumaty and Claris, are like depression and also bipolar disorder, which is quite common nowadays. Also, social anxiety disorder and post-traumatic stress disorder. So, as for the rare mental disorders that actually I found on the internet, I've never heard it before as well, before I did my research, are like depersonalization and alien hand syndrome. Not sure whether you guys heard of it before. So depersonalization is the feeling of being disconnected or detached from one's body or thought. Sounds like a scene in a movie, you know. And as for like alien hand syndrome, it's like a phenomenon in which one's hand is not under the control of mind. So yeah, I feel like it's very rare and it's good to know as well, all these rare mental disorders. Yeah.
Okay, thank you for your sharing. And then now we will move on to our second question. So actually it's like as shared as you guys just now, there are actually many mental disorders going on in the society. So is having mental disorders something preventable like other diseases? Like if we have other medical diseases, which we can actually prevent them by having a healthier meal or healthier diet. But what happens when it comes to mental disorders?
For me, at least based on my understanding, please correct me if I'm wrong. But I think instead of the word preventable, it should be, is it something manageable? Because mental health, like I said, as definition based, like what Claris said also, it is something that we all go through. So it's impossible that in a life we don't feel anxious, we don't feel depressed because of a bad event or something like that. So it all, bottom line, is about the severity of the condition itself, or how severe the entire disorder is. So let's just take the basic one. I mean, the one that is normal, common, depression disorder, borderline depression disorder, those kind of things. I think, of course, it's manageable in the sense that there are a lot of options of us treating it, and a lot of options of us making sure that the severity of the condition is not as bad. But if you say preventable, I don't know if that is the right word for me, to use, for me at least. I think that it's impossible that we all don't go through it at least at one time of our life. It's like, for me, it's just that how well we are going to treat it, how well we are going to manage it, what do we do to ensure that it doesn't go to an extent where it's so severe, where we need medical prescriptions and all those kind of things. Because a lot of these borderline disorders can be treated in other ways, like therapies, play therapies, and all those kind of things, where it might be more effective and, in fact, medically healthier to start off with those kind of things instead of straight away going to prescriptive medicines. So coming back to the question of if psychological disorders is something preventable, I think that it is manageable, at least based on the severity of the disorder itself. Of course, if you have if the severity is so intense and you have to go into psych wards and psychotherapy and all those kind of things, to that extent, then that's a whole different question. But for us, daily anxiety disorders or panic attacks or depression for a certain period of phase and all those kind of things, I think instead of the words preventable, because we are definitely going to go through it, we are definitely going to face it whether we like it or not, but the right word for me should be whether or not it can be managed, and it definitely can be managed, for sure. There's a lot of resources, there's a lot of help, there's a lot of ways that we can manage it and control it. But so I don't think, for me at least, the word preventable is the right word. Anyway, I'm looking forward to listen to the rest of them.
Do Claris and Ming have anything to add on?
Yeah, I have something to add on. So what Sharon Marti mentioned, I like the word manageable because it seems more positive in the light. It's reframed quite positively lah. And then Sharon Marti did touch upon treatment and all, but I will not go there for now. Regarding preventable, it's more of there are things that minimizes the risk factor of us developing that mental disorder. So in psychology term, is the risk factor itself. And this risk factor, right, it depends on our level of emotional regulation. How good are we in recognizing our emotion and managing our emotions? That was emotional regulation means, as well as our level of resilience. So everyone has different levels of resilience. We all face COVID-19, but how each of us cope with the COVID-19 stressful situation is very different. So how do you build emotional regulation and resilience to prevent yourself or to minimize the risk of developing psychological disorder is very cliche, but knowing who you are. It is a high sense of intrapersonal awareness, right, that really protects you from developing the mental disorder, as well as having other protective factors like good support system from your family and friends. And healthy lifestyle practices also do contribute in minimizing the risk factor of developing psychological disorders. Yeah, that's right.
I definitely agree. I think, like she said and emphasized, mental health is definitely something that is very personal. It is, as much as we've got psychological books and all those kind of things. I think that at bottom line, right, however you deal with it and however I deal with it, it will be completely different. And that comes back to what she says as well, how well you're able to regulate your emotions, how well you're able to come back and say, okay, you know what, take a break, think about what to do, reflect, and then act on it. Not every one of us will be able to go so quick onto that thought process. You know, some people deal with it differently. So I absolutely agree with what she says.
Understood. So let's move on to the next question. So as you guys said, everybody deals with like mental health issue differently. So it's impossible for me to know what the other person is actually thinking right now. So how can one like me, who has no prior mental illness knowledge, can help to recognize like the early signs of someone catching a mental disorder?
I think that some of the early signs include like having a loss of interest or even having withdrawal symptoms from like activities that you once look forward to, and also having excessive fears or worries, basically something that is irregular in your daily routine. So I think it's important to be aware of how you feel constantly so that you can recognize the early signs of catching mental illnesses. So I think this relates to what Sharumaty have mentioned just now, let's say like prevention of mental health illnesses. So I think it's not about prevention. I think it's more towards like recognizing the early signs so that you can get treatment on an earlier stage, and then it's more manageable. Yeah.
Sharu and Claris, is there anything to add on to it?
Nothing from me. I think she said pretty much what I was thinking as well.
Okay.
Yep.
Okay. So I think that's all for the general questions on mental health. And now we can move on to our second segment, which is the impact of COVID in mental health. Like Clarice has mentioned just now, everybody handles COVID situation differently. Of course, all of us have been undergoing a lot of stress, whether it from the movement control orders or from financial and everything. So we all know that it has been a tragic 2 years, and suicidal rate and depression has been increasing dramatically. So is there a specific reason of how COVID can affect one's mentality? Or to extend this question, maybe like us confining in a space affecting our mentality?
Wow, of course, we have to talk about COVID-19, don't we? Well, okay,
Yeah.
thank you for this question. So before I'd like to explain like possible specific reasons for how COVID-19 affects one mentality, I'd like to reiterate that mental disorders are multidimensional. So multidimensional means, right, it means that there are various causes and these causes interact together to determine how at risk you are of developing a mental disorder. So specific reasons for each individual is hard to determine, but what I can say is that I think all 28 of us here can agree that COVID-19 really shifted our life trajectory, and like what was once normal to us was clearly no longer the norm. So to think back of the specific reason, right, why don't everyone in the audience maybe take 1 or 2 minutes, right, and think back on what we have collectively been through as a society since last year. You know, starting off March 2020 with the introduction of COVID-19 as a pandemic by World Health Organization, panic buying, numerous SOPs, lockdowns, economic recession, and variants after variants. So regarding the specific reason of how COVID-19 really affected us, I would say is the continuous introduction of more and more uncertainties and stresses during the pandemic that keeps taking a toll on our coping capabilities and cut us off from meaningful social connections like what we used to have. So yeah, that's all from me.
Thank you, Clarice. The announcement from our Prime Minister of the non-limit of extending the movement control order is still vividly in my mind up till now. So is there anything that Sharon and Ming wants to add on to it?
Well, I agree with whatever she said. I think there's so many different reasons of how it could have affected us. And like she said, there's like different aspects of it: financial, psychological, family, friends, social life. Like as humans, we are a social creature. And suddenly you put us in 4 walls and said you can only see the people who you live with. Oh my God, I lost my mind. And then especially for me, like I'm an extrovert, you know, it's like, how do I not see my friends? And you know, video calling and this kind of concept is not the same way as physically being there, physically being able to look at them through their eyes and say, no, I feel their connection and all. I definitely think that it's completely different. And in fact, this session itself would have been completely different if we were physically there. I'm sure all of you all know that. So yeah, I think the whole, not being able to socially interact with people physically, I think that one really took a toll on me. And I think the first few weeks was okay, but as it kept extending, like Chanmi said, I lost it at some point of my COVID journey. But anyway, here I am, so it all went good.
Yeah, since we are all university students here, so as statistics show, lockdown has really induced an immensely heavy pressure on the students, especially having to study online. So do you have any advice to be given to parents who are overlooking their child or the students to prevent catching mental disorders and to cope with stress?
I think the preventive interventions can be categorized into reducing the risk factors such as stress from the studies and enhancing protective factors such as establishing positive parent and child interaction, which I would like to emphasize for this question, because I think that sometimes Asian parents, they tend to have high expectations on their children. So I think in this context, it's important to establish, important to manage expectations when it comes to the pandemic situation. Everything is virtual, and there's this Zoom fatigue situation going on, which I can really relate on a daily basis during my online classes. And so what are the things that the parents can do is that they should check in regularly with their children and be aware of the early signs of mental illnesses, as I've mentioned just now. And also they can carry out gradual conversations and other activities besides talking, such as painting, drawing, or any recreational activities, so that their children can express themselves and manage their stress sustainably. And ultimately, I think the parents should also provide reassurance whenever needed by listening to their concerns, and also provide necessary guidance and pointers whenever they feel lost. And especially during this time, there's a lot of uncertainties, right? So yeah, I think the parents play an important role in such situation.
Thank you, Ming. So yes, communication is key. So moving on, and we are finally entering our main topic, which is technology on mental health. So although technology has brought many improvements to a human's life, it is undeniable that it comes along with some problems too. Could you please share with us how technology affects people's mental health in the digital age?
Okay, so I think there's a fair share of pros and cons to technology in affecting our mental health. So starting with the pros, Claris just mentioned metaverse. So the good thing about that is that where cases like COVID, when we couldn't meet people, and we are social creatures and we couldn't physically be there with the people that we love, metaverse and all are kind of concepts where even if you can't physically be there, they can build an augmented reality where you can go and meet people, but it's all virtual. But its technology is so good that it makes you seem like you are actually there. And instead of just sitting on my table here in my four walls and looking at you all through the screen, I can actually go to a whole different virtual reality world and meet people. So coming back to my biggest problem during the COVID-19 was like not being able to socially engage with people. Those are kind of technology that is going to be really good for people like that, or in situations like this. And like that is just one example. Another thing is during the COVID-19 pandemic, eventually there came a point where therapies and all those kind of things also moved online, where people could, just book an appointment and then have it through the screen. So I don't know how effective that can be compared to physically being there, because, I'm sure Claris can also say, since she's a psychological student, that nothing beats sitting beside someone and actually feeling their vibe and aura and all those kind of things. So I don't know how effective that can be, but it is something. In a phase of crisis where we cannot go and see someone, all we got is the people we live with and our four walls. Those are kind of technology that has helped us so much in terms of mental health. And like let's just say our university life. Yes, it is not physical. Yes, it is not what we expected, but our life still went on. So instead of us just staying in our house and dwelling upon when is this going to end? How long is this going to take and everything? I think because of technology and all this Zoom and Meet and all these kind of platforms, we were still able to move on with our life. We were still able to carry out our daily activities. The only thing that it was virtual, but it was still something. Can you all imagine? I myself complain about online classes every time. Every time I speak to someone, I complain about it. But then thinking about it on another perspective, if only I did not have my online classes, if I did not have my assignment, test, and quiz, I would be sitting every single day for like 6 months, 9 months, just thinking about when is this going to end and how long is this going to take? When are we going to get our vaccine? Because at that time we didn't even get our vaccine. All those kind of questions would have made my mental health even worse, So like I think that these are type of like platforms and tools and services that were able to be online in time of crisis like COVID-19, where it really aided our mental health and where it really gave us something, even if it was the bare minimum. And it would have been amazing that if it was physical, but the whole idea of technology and the advancement of the internet, like today Malaysia is coming up with 5G soon. We also have got like other technology like augmented reality and all this kind of AI and all, where it's making people's lives so easy. Those are kind of technology that really is helping mental health. Now coming back to like the cons of it, I do feel like there is a very, very sweet spot to how you handle your technology, especially social medias. I am definitely one of those people where eventually I want to come out of all social platforms, because I think that it has maybe more cons for me than pros. Although I do definitely think, as a computer science student myself, I definitely think that social media has a lot of pros, and that social media are like ways like today, okay, I am from Klang. So if all of you don't know, Klang is underwater right now. But look at social media, getting people to come and rescue us, getting people to come and help us, and all those kind of things. If it was not for social media, none of that could have been happening, because, the rakyat is helping each other. We are like sending contact details and awareing people of where is flooded and where is not flooded. So in that terms, social media is great. But I also think that social media has a lot of negativity and false positivity, and like you have to, I feel like social media is very like, you have to be this person, you have to be posting this amount of posts, you have to be getting this amount of likes, a lot of expectations and standards that I don't know who created, that has definitely been taking a toll on many of us, whether we like it or not. Let's just say for me, my instance, I'm going to be very open with all of you all. Before I post a picture, sometimes I have to go text my friend who is like a pro social media user and say, hey, is this time okay for me to post my post? It's like, it's not even relevant. But at the back of my head, I'm thinking about like likes and people engagement and all those kind of things. And like, how much is that actually affecting my mental health? So for me, at least, I think that social media has a very, very sweet spot where there's a pros and cons. But so that is some aspects of pros I think technology has brought us. And forget about COVID in this case, but like when it comes to physical engagement, right? Sometimes I go to shops and all of us are on our phone, not talking to each other instead. So those are like kind of things where I think that, some pros technology has brought to our lives. Technology is supposed to be making our lives better. Technology is supposed to be advancing and lessening our burdens. But then there is a small sweet spot that you've got to be in to ensure that it is only pros and very minimal cons. So that is my take on the improvement and the advancement of technology towards mental health.
Thank you, Sharon Marti. Your experience is very much more relevant. How do you say relate? Like, I can relate it. Like, yeah. Remember, posting on Instagram has a golden hour where we can get the most likes and everything. And by the way, I hope you and your family is well in Klang, and also to all the people in Klang as well.
Yes.
So I think Claris has something to add on, and I will pass it to her right now.
All right, thank you, Choi, for that. So I just wanted to add on to Sharu's point on the pros and cons of technology on mental health in digital age. So I'd like to bring up the cons first. Okay, let's talk about the bad things first. Let's not talk about the good things. But okay, so the bad thing is that a 2017 study in like among young adults found that young adults aged 19 to 32 years old are 3 times more likely to feel socially isolated than those who did not use social media as often. So yes, in a sense that technology does bring us together, but however, when we see Instagram stories, there is this sense of social comparison, like, oh, this person is doing this person is doing that. That's personally what I have been affected, like, oh, this person joining so many clubs, and I'm like, oh no, am I so inadequate to that person? So I'm pretty sure some of you may face the sense of social comparison to a certain extent, but you see this continuous attack and this continuous socially comparing ourselves with others, right? Especially like technology and all, right? It takes a toll on our self-esteem.
Yes.
Like we start to think like, are we really that good compared to others? Because when we on technology, we're like, oh, this person doing this, that. So it really affects our self-esteem. But once again, technology is really useful, and of course, progress cannot be stopped. So regarding mental health, right, actually, what I like about technology is that technology really destigmatizes mental health. As you can see before this, right, can you imagine you talking to your grandparents or maybe your parents about mental health before COVID-19 started introducing all these mental health resources online? It is so hard to approach this kind of topics to them last time. But with technology, it really became an educational platform where it teaches people like mental health is okay to be talked about and all. So really from that, right, and regarding another aspect of technology is the AI algorithm, right? So let's say you are suffering in your mental health journey and you really need help. So one thing I love about technology is the algorithm factor. Means like you search one mental health resources and it keeps leading you to the correct and proper information sources that you can seek help from. So to summarize, the main pro of technology in regards to our mental health is really an option and a platform for us to actually seek help in times like this, especially when we are confined at home. Yeah.
All right, thank you, Claris. And then moving on with what Claris has said, which is like using AI algorithms in helping people to tackle mental health questions that they have. And then we all know that despite having the negative impact, technology do have positive impact on the mental health sector. And one of it is what Claris has mentioned just now. So could you guys please tell us more on how technology can contribute in improving the public's mental health?
All right. Thank you for the question. So I think I already highlighted some of the pros earlier on, but now I think let's move on to COVID-19 instead, because like once again, I have to reiterate that really technology became a platform for an additional platform for us to seek help on. So before this, right, back when COVID-19 wasn't a thing, people like, therapy was such a taboo topic. And because of this taboo, right, is that a study found that 70% of people do not have access to traditional in-office therapy. But now with online therapy, right, really make online therapy and technology and stuff like that, it really make mental health treatment more affordable and accessible. So even if, we can, last time, if people want to ask us to take therapy, like, oh no, we are busy with our studies and all, right. But with online therapy, right, even if we work unconventional hours, we really can still access this mental health services online at any time possible. And there are so many apps currently at the moment, like offering online mental health services and all. And one of the apps that I like to highlight is PlusWife. So PlusWife is a mental health service app in Malaysia. And in this platform, right, it connects various mental health agencies like MIASA, Malaysian Psychotherapy Association, Mercy Malaysian, ADDK, and like more, right? So regarding to public mental health, it really destigmatizes and provide a platform for people to not be judged, seeing them, like, to not be judged of receiving mental health therapy. At least they can now confidentially in their homes have the access to online therapy. Rather than last time, imagine you see like this person walking in, like, oh, I saw you that day walking into the psych ward or something like that. That'd be it is very sensitive for us, like, oh, it's our self-image and stuff like that. So yeah. That's all.
Yeah, I agree with her about like how, I don't know, maybe not self-image, but like you feel like oh my God, something is wrong with me. Because I myself, when like they are like, I encourage therapy, so like I'm gonna be open with it. But every time that I felt like I needed therapy, the first thing that comes to my mind is, oh my God, people are gonna think that I'm gone. People are gonna think that I'm crazy. Words are like that. So I feel like I would also not. I don't have the guts to go physically into their door and speak to them. So technology has definitely created a environment and platform where I can do it like this. I can speak to my therapist like this. And that is really, really good because I speak so much about mental health and I myself feel like this. Can you imagine people who are lesser, lesser aware about these kind of topics? How are they feeling? How hard is it for them to accept that I even need to go to therapy and how much it takes for them to do it? So in that case, I think that COVID-19 really helped all these aspects of mental health to become virtual and much more easier to access, and that's really good in terms of like the development of our technology.
Thank you, Sharu. And then Claris, about the application that you have mentioned it just now, could you please type it in the chat box below so that all of us can explore it after this session ends? And Ming, is there anything you would like to add on to it?
Speaking of the low awareness in mental health, I feel like there has to be, like the misconceptions of mental health has to be addressed as well, so that people are not afraid of seeking for help when they have early signs of mental illnesses. So I feel like education towards the public is also quite important. Yeah.
All right. Thank you, Ming, for your sharing and Claris for typing in the chat box below. So to our next question. It was said that virtual therapy and psychiatry was up 302%, that's 3 times, compared to before the pandemic started. So based on your opinion, what could be the possible reason behind this rise? Maybe Mingy, you would like to take this question?
I think one of the possibilities is that before the pandemic started, I think because of technology has improved access to healthcare, like individuals who were denied care due to a lack of access of qualified health professionals, especially those in rural areas, or with disabilities or with limited resources, can now access to quality healthcare in a matter of minutes through, like, let's say, telehealth, also known as telepsychotherapy, telepsychology, and telemental health. So let's say like Befrienders is an example of telemental health. So what they do is that they carry out standard telephone technology services to deliver psychotherapy to let's say the patients. Yeah, so web-based interventions have shown efficacy across a broad range of mental health outcomes. So I think this explains the question why there has been a rise of people who want to have access to mental health through technology, because it's easier to access. Yeah.
All right, thank you, Mingy. And since we're in the technology era, could you please, could maybe Sharu elaborate on the tech innovations that have changed the way of diagnosing mental disorder?
Okay, so diagnosing itself, I don't know how well, like how well you can diagnose it through virtually, but then because since we are in the topic of COVID-19 and doing therapies and stuff like that virtually, so of course my therapy probably has got years of experience, and just by talking to me, she or he can probably tell me what is wrong with me or what I should do. But I don't know how effective it is, or maybe I don't have the experience of knowing how effective technology, as in the virtual world, has helped diagnosing mental health. But when it comes to mental health itself, I definitely think technology has played a lot of roles. Like we have mentioned so many examples of how it has helped us. And first of all, it is like getting access to therapy and mental health treatments itself. I think that itself is a very good thing, because like you said, a few years ago it was so low, and now suddenly it's like 3 times more. And like those are kind of advancement of technology that we should really be talking about, because like times of crisis in COVID-19 where we were all desperate, and mental health was like a very, very important aspect because we were all shut down at home. Because of these kind of reasons, today, if I want to have a therapy session with a therapist right now, it's going to get me a few clicks and I'm going to be on a call with someone. And because it is virtual, it has definitely been cheaper, because we all know, especially in Malaysia and in most Southeast Asian countries, therapy is very, very expensive. And like for students like us, just to think about paying 400 ringgit to get into a good therapist and for them to consult us, we think about it so many times, because we got to think about how valuable it is. Will it work for me? What if it doesn't work for me? And all those kind of questions. So making it virtual, the price of having therapists is so low that every one of us can just try. Because I think I'm a believer of, like, you don't have to have a psychological disorder to have a therapist. You don't have to be mentally affected or something like that to go on therapy. I think that every one of us, just to keep our mental stability intact and to ensure that we are okay and there's like someone to listen to us other than our loved ones, I think that I definitely encourage every one of us to just go for therapy, even if it's not weekly, but like, on like a monthly basis at least. So in that terms, having it virtually, because of the advancement of our technology, it has definitely been able to reduce the price so much. And not only we get to speak to people of locally, that means locals therapists, we can also get therapists of different countries, because it's all virtual. Like there are so many known therapists companies and all in other countries that actually offer us very less payment because of the virtual world that we are in. So in that terms, I definitely think technology has improved us in mental health. But the question of whether diagnosing mental health has been able to be more effective because of technology and because of the virtual world, that I think that I am not entirely sure of, because I think that is more of a question to ask a psychologist or the therapist instead of me, because I've got no clue in like how you even diagnose. And I definitely think that I should not be speaking about it in that aspect, since that I don't have much knowledge on it as well. But yes, I do think technology has aided the awareness, the advocacy, the treatments, and the accessibility of mental health. So that's my take on that question.
Yes, I do agree with you, especially on the aspect where it is not necessary that you have a mental disorder for you to meet a therapy. Therapy is someone that you talk to make sure that your mental is at a stable state. And okay, so in extending to this question, since actually a lot of Western countries, they are normalizing meeting therapy, but not in Southeast Asia, as you have mentioned it just now. So how would you rate the awareness of Malaysians on the topic of prioritizing their own mental health?
I think that, sorry.
Yeah.
Go ahead.
Oh, okay. So I think it's pretty moderate, but then with the recent pandemic, as everyone has mentioned just now, it has become more prevalent and brought to the general public's attention, including me, particularly to the rising occurrence of mental health illnesses and also suicidal cases, unfortunately. And also there have been talks and campaigns, as we all know, around like the clubs, around playlists as well, on mental health recently and in the past years as well by, let's say, Malaysian Mental Health Association and MIASA as well. However, I still feel that there's like some misconceptions about mental health illnesses, like people think that people with depression are ungrateful, things like that. There are still such misconceptions around that hasn't been addressed enough nowadays. So I wish that that portion of mental health can be addressed more adequately. But also thanks to like efforts from the NGOs and volunteer groups, there's now a greater awareness of the issue. Yeah, and the stigma of reaching out for help is slowly eroding as well. So about the rest.
I actually wanted to say what you said as well, because COVID-19 was definitely the start for it to be like, I think someone mentioned like how hard was it for us to speak about mental health among our grandparents and like relatives and all before COVID-19. Now that when COVID-19 started, the health minister was encouraging the way we should manage our mental health, and like in newspaper, the news platforms, the social media, every single places, like even like Taylor's clubs itself. I think that we've done so many mental health programs and events. I think that itself shows how aware we are. But again, like Ming said, that there are certain aspects of like the advocacy and the awareness that maybe we have not reached yet, especially in terms of like when it goes to physical therapy, how expensive it is. It is only, I believe that it's only expensive because of how rare, as in, I mean, like not rare, but how uncommon therapy is. Supply demand. So as like our like we want it more and more people are willing to go for therapy, for sure at some point the price of it will decrease. So because of how uncommon it is, and because how I don't know about all of your home environment, but I definitely did not grow up in an environment where speaking about my feelings and communicating our emotions was a normal thing. Unless and of course I am like crying and I really need to let it out, I don't really speak about my emotions. So we all grew up in a society like that, and now suddenly it's getting more aware. People are like, oh my god, I actually do need help. So like I think it's slowly getting there, but it has a lot of work to do. And only when therapy and treatments and accepting that you need mental health help is more common, only then I think that we would be a society where mental health is a common thing. As in, mental health is something that any one of us could be going through, or any one of us could be, seeking for help. So I think we reached to that stage. I think that Malaysia does definitely have a lot of work to do in terms of mental health.
Thank you, Sharon.
The question also.
Yeah, sure. No, it's fine. I was going to ask you too.
Okay, I want to add on to this question, but then I would like to go back to the treatment and technology. I think that was not well illustrated for now. But regarding the Malaysia's initiative in handling mental health issue, I think Charu and Mingi really highlighted how the youth advocacy is taking the control of, the youth is taking control, advocating mental health disorders. You can see from Instagram posts like, okay, I'm just gonna promo here, Let's Connect and Relate Malaysia and stuff like this. So, but what I want everyone to recognize is that all us, in a sense, are privileged to be in the urban city area to recognize and learn about mental health disorder. But right now in Malaysia, the outreach, especially towards rural areas, is not there yet. There is still the stigma there yet. So that is one of the issues, stigma in terms of, because of the outreach. And then the second thing I'd like to highlight is that according to a Cambridge University study, Malaysian has a significant deficit of psychiatrists and psychologists. So in Malaysia, right, there's only one psychiatrist or clinical psychologist per 100,000 population. And this is not enough because the World Health Organization recommends at least 10 psychologists or psychiatrists per 100,000. So can you imagine? The ratio 1 to 100,000 and 10 to 100,000 in Malaysia. So currently it's not enough, there's not enough psychiatrists in Malaysia. And actually there is a high supply and demand in Malaysia because globally is 1 in 4 people have mental health issues, but in Malaysia is 3 out of 10. So regarding the supply and demand, right, it's more of the old stigma, because I know a lot of psychiatrists who are unfortunately contributing to the brain drain because they are not opportunities, we are not recognized. Our occupation are stereotyped and are stereotyped, like, like, oh, only psychiatrists only see like really crazy people, like because of this stigma, because of these labels, right? That's why Malaysia, we have really deficit in terms of psychiatrists. It's not that a lot of people not studying a lot, it's because we have no opportunity to progress as having a career in Malaysia at the moment. But I think it's changing currently with more acceptance, hopefully. Yeah. And regarding back the treatment, right? okay, since I did learn a bit here and there. So in terms of technology and diagnosing mental health psychologists, right? So when you want to see a counselor, sometimes a counselor, because counselors are not trained in medical field, so they may direct you to psychiatrists. But to diagnose a person, there's this thing called mental status examination. And this mental status examination, right, it looks at your appearance, whether one person behave like there's something different in terms of appearance, thought process, mood and affect, intellectual functioning, sense and sensorial means that the person's awareness of the surroundings. So when it comes to diagnosing mental health virtually, like, this has been a very hot topic among my lecturers because some of them, because like in research studies, right, there are technologies like facial recognition, biometrics. We already have the technology to detect certain people with that, whether they are at risk of having mental disorder because of their how they react, how they interact, how they react, and maybe through AI algorithm that filters out the patient's or client's medical history. But there's one thing that it cannot be diagnosed online is how the person is, because in the end, right, we cannot really see the body languages and all. Like talking about technology, I can be, might not be me. I can be wearing a filter and all. So it's very difficult for like clinical psychologists and psychiatrists to treat people at the moment. But currently there is technology focusing on that at the moment. But whether it's mature enough, not yet. Maybe metaverse will help. Who knows? But yeah.
Hopefully.
Yeah, thank you, Claris. And then actually, she already bring us to our next upcoming topic, which is the take back or the unethical usage. The first one would be the one that you say that we might put on a mask, especially during like virtual meeting session with our therapist or like a psychiatrist. So given the OPEC, my upcoming questions will be, given the opaque nature of the digital economy and the disruptions associated with rapidly evolving technology change, new ethical issues are arising in psychiatry from the use of technology, such as the use of unvalidated apps, medical websites with poor quality information, or self-diagnosis and self-treatment may lead to medical risks. And how can relevant authorities work hand in hand to combat this issue?
I think that the collaboration between the website authority, and health authority, and also like KKM and MCMC, the Malaysian Communications and Multimedia Commission, it's pretty important to validate the healthcare information and to ensure that the information up to date. Because I remember at the earlier stage of COVID, there are news like, oh, drinking hot water can cure COVID, stuff like that. All those very not validated information and stuff like that. And also I think that maybe KKM can issue licensing or implement strict policies to these websites before they disseminate healthcare information. Because one thing is it's healthcare. It affects the livelihood of the people around us and the citizens of the nation. So I think all these measures are quite essential to combat this issue. The government has to step in to make sure that the informations are valid.
Okay, on top of that, is there any ways for people like us, whenever we search for information online, is there a way for us to validate whether this piece of information is actually helpful towards our problem? Besides just blinding. It's fine. Yep.
Oh, okay. I think consumers have to be educated on the appropriate portals to retrieve information and red flags. Like KKM, they have an official website for you to check on maybe COVID information and stuff like that. I think recently there's a COVID alert for the COVID-19 alert for the information, whether it's valid or not, or they'll remind you that to read this cautiously so that you know that it's perhaps not valid information. And so we have to really look out for the red flags when it comes to reading information online. Some of the red flags that I want to point out is that perhaps the information sounds very one-sided or very biased, or the information, there's no claim, or it's not even cited, there's not evidence cited. Then you have to watch out. It might not be valid information. And also, there's a conflict of interest in the article that you are reading. Okay, yeah, that's also one of the red flags. So I think looking out for red flags is one of the important measures.
Okay, thank you, Mingy, for the heads up. And then we know another major takebacks of using technology in the medical health field will be data privacy, and it has always been a very controversial topic. Sorry, could you please address this data breaching issue? Maybe Claris, you want to answer this?
All right, so thank you for this question. Yeah, I mean, looking at the past few years, the trend has been really focused on big data. And in big data, recent years, there's been certain political manipulation when it comes to voting, because of big data, it can actually adjust because of the intrusion of data privacy and stuff like that, right? It actually causes it shifts our personality in the sense that it actually affects political voting behavior and stuff like this, right? So why I want to tell about the political side, even though it's not really relevant to mental health, is that I just want to lay out a clear picture, because this is actually an issue in Malaysia in a recent documentary I watched, and it's not only the US. So imagine if this can affect political situation, this can definitely affect our healthcare situation. And unfortunately, in this data economy, right, I think it's really a given that there will always be the risk of personal data leakage. And unfortunately, healthcare organization in particular is being targeted now and more. So to give our audience some figures to ponder about, in the United States, right, the 2019 Healthcare Data Breach Report revealed that the number of exposed healthcare reports increased 37.4% from 2018 to 2019. And this increase in percentage, right, is equivalent to 41 million breached medical reports in 2019. Imagine, this is 2019 report. I cannot imagine the numbers for 2022. So yeah, so while I'm not discouraging the use of technology in mental health, because technically we all need to upload certain information like our personal details and all, but it's really for us healthcare consumers, right, both medical and mental health consumers, right, is really something to ponder about lah. And honestly, regardless of whether it's a healthcare industry or not, all our data is at risk. It's just a matter of how the relevant authorities and we ourselves mitigate the risk. So one of the established policies that relevant authorities have established, but this is in US. I'm not sure whether the Ministry of Communication, Media and Communications in Malaysia have really emphasized this rule, but the security rule is Health Insurance Portability and Accountability Act. So this rule is a guideline that actually make it a legal point that all this healthcare breach is being minimized and all that. And for us as a consumer, the only way we can really navigate around the issue of data privacy is being a critical consumer. It's just knowing that your data currently will always be at risk, and the length of how you do that don't just set 000 as a password come on, definitely your data will be breached take the extra step a bit here and there. And another way for us to be a critical consumer is just maybe looking up to the Malaysia's media and communication website on how to be a critical media consumers. Nowadays it's just a matter of extra clicks to verify the information that you see.
Yeah, Sharu, you can add on to it.
I really like how she said be a critical consumer. So like I said just now, one of the reasons why I want to get out of social media is because of my data breach as well. Because like she said, it's like our data will always be at risk. We can do all the two-factor authentication and using your phone, Face ID, and all those kind of things. But let me tell you, after studying so much, right, on my computer science, I genuinely feel that there will always be, even if it's a small amount of risk, there will always be a risk of our data being out. So it's funny because I had a podcast session with AOT and another group of people as well about how My Sejahtera, so all of us definitely have My Sejahtera on our apps, right? About how My Sejahtera had a rumor of our data being released. So at that time, right, My Sejahtera was still developing, and like it was still like in the first few editions of My Sejahtera, and there were rumors where our details were being breached. So we have so many things in My Sejahtera. We have got our house address, we've got our IC number, we've got our phone number, we've got, and this tree itself, this tree literally can get you into any other formal government information. Very important is your IC. They have your IC details, and they literally can get anything about you. So like those are kind of things where you'll be thinking about how protected is my data, how protected is all the things I'm putting on the internet. My Sejahtera is just one perspective of it, but like things like our social media and all, Instagram is under Facebook. Facebook itself is a huge company, but do you know how many times they have gone through data breaches cases, and the name of Facebook itself damaged because of their data breaches. So thinking about it in that aspect, I think bottom line, yes, we have MCMC, we've got the government, and we've got all these authorities that are backing us up and our privacy. But like when it raised up to a question of My Sejahtera, which is developed by government itself, then you can see like, oh my God, if the app itself is developed by a government, it is backed up by MCMC and all the KKM and all those kind of government bodies. If it's them itself and we feel like our data could be breached, then can you imagine our personal accounts? Can you imagine what risk factors there are of putting all of our private information on our personal accounts? So I absolutely agree with Claris saying that yes, it is all being protected by all these bodies, but bottom line, we got to really be a critical consumer where we decide what we put on the internet. We decide what we put on the virtual world, and what are we going to do to make sure that our data is being protected. So yeah, I really like that.
Thank you, Sharon and Claris, and I'm sure all of us has witnessed how data breaching can cause so much problem to our daily life back in the days when My Sejahtera wasn't available and all of us had to write our information down on the notebook, and how much scam and how much of the fraud cases that has been reported during that period of time. So moving on to our last question for this topic on take back and unethical use. Should therapists recommend digital technology when patients lack technical skills and understanding of the digital economy? Maybe Sharu, do you want to share with us?
Sorry, repeat the question again. Can I get another?
Yeah, sure. Should therapists recommend digital technology when patients do not have technical skills and understanding of the digital economy?
Well, if it's in terms of mental health, like Clarice said just now, I don't know how well diagnosing psychological disorders and mental disorders are how effective it is. So in that terms, I don't think so. But as she says, there's definitely a lot of technology tools like face recognition. There are even like algorithms and tools where they can actually test your entire body reaction according to the aura and all those kind of things. So those are the kind of tools that it could be incorporated, which hopefully they do. But I guess that is like a long-term thing. But when it comes to like whether or not therapists should encourage the use of technology, first of all, I would like to disclaimer, I'm not a therapist. I don't have a lot of background knowledge on the psychological. I do have a little bit, but not a lot. So my advice here is just based on my personal opinion. So I think that, again, as I mentioned, every single thing really has a very sweet spot. So it's about how well you control the usage of technology on a daily basis, and how well you let what is on the technology affect your daily life. Like, for instance, COVID-19 again, right? When we used to see the number of cases every day, right? I'm sure it affected a lot of us. It was asked again questions like, is this never going to end? Are we going to be like this for the rest of our lives? Are we going to grow old with this? And all those kind of things where definitely, made us feel very anxious and like looking at all those numbers. And that's just one example. And then other things like comparing each other with our peers on our social media. And then like, let's just go back to digital privacy breaching. There was a phase where I hope I'm allowed to say these nudes were getting leaked, all those kind of all those kind of cases and all. Can you imagine how badly it took a toll on so many people? So I think, like, again, we have to be a critical consumer in the whole technological world, especially in the internet world. And it is really, bottom line is really how well you can control your usage and how well you're going to stick on the sweet spot. That, I think, that is my take on it. Again, like I said, I can't really speak on behalf of therapists and whether or not they encourage it. I guess it also depends on the severity of the disorder itself and what disorder it is. Of course, that is another thing. But in my opinion and my experience based, I think that every single thing has a very, very sweet spot that we need to control and make sure this is the usage and there's nothing more. What people post, what people do, and how they react and their engagement towards my post and whatever I do is not going to affect me, and it will not bring so much of value into my life. So those are kind of things, I guess, that we need to cultivate in the use of our internet world. Yeah.
Thank you, Sharu. And is there anything to add on to it, Claris? Yeah, sure, Mingy.
Actually, I do agree that therapists should recommend digital technology because, like, we cannot guarantee there won't be relapses after certain mental illnesses. So technologies such as like development of sensors being embedded in like a smartwatch or wearable devices that can measure heart rate, posture, stress data, or stuff like that to indicate like maybe signs of relapses of mental illnesses. So what this does is that it can educate your like the patients to actually detect these signs themselves. So that in the case of there's unavailable, like if the services is unavailable, they can detect the early signs of relapses so that they can know when to seek help exactly, so that it won't get worse when there's relapses. So I think that recommendation of digital technology is pretty important. Even when they lack technical skills, I feel like they can be educated on that aspect. And I feel like perhaps applications can have like easier navigation features so that more patients can have access to these technologies easily. Yeah.
All right, thank you, Mingy. So, is there any advice or supporting words that you can give to the family or friends who are currently undergoing mental disorders? Any one of you can take this.
Okay, then I'll take it, right? So thank you for both Sharu and me for handling the previous question. So regarding the supporting words, right? The first of all is be patient towards your loved one. Because for the person who's having the mental disorder, right, no one wants to burden their family, no one wants to be labeled as a burden that needs to be taken care of. So the key thing is be patient towards your loved one who is struggling in their mental health journey. And the next thing I'd like to highlight is that oftentimes we focus so much on the individual who's having the mental health disorder, but we forgot about the families or friends. So these people, they are usually labeled caregivers, and for these caregivers, right, seek help. Remember that you are lending so much of your emotional energy towards caring for your loved one, right? But how about yourself? No, because you are human too, and many research has already pointed out that caregivers is not being studied enough, like the amount of stress and their experience of caring for another loved ones, right, is not being focused and researched enough. So to all caregivers, remember that you can seek help also. And this extends to not only mental health disorders, but also medical disorders. Is very challenging for caregivers. Yeah.
All right. Thank you, Clarice. Anything to add on, Sharu and Mingy?
I think my words of encouragement would also be somewhat be patient But in the sense, like if I'm going through something, and if anyone else is going through something, I think that the first thing is that it's going to take time for you to feel better again. So don't immediately, like let's say therapy, right? You can't expect you to feel immediately better right after one therapy. You can't expect your journey of healing yourself to be immediately showing outcomes of positive progress. I think it takes a lot of time. And especially like I mentioned just now, and many of us said that mental health is definitely something that is very personal. The way I deal with my mental health and the way you deal with your mental health is completely different. So like our experiences of going through it is different as well. And like nobody really knows how long it's going to take for us to completely come out of it. So I would definitely say that it's going to be a process. How long or short it is a different question, but just hang in there and wait until you feel good, because I definitely think that seeking for help and going through treatments for mental health is definitely the positive way of dealing with it. And no matter how long it takes for you to completely heal from it, I definitely think that you should just be patient and wait. And there will be progress. It's your own journey. Don't let anyone say anything about it. Go through it by yourself, and eventually you'll get out of it, or at least be able to manage it. That is my words of encouragement for the ones who are going through mental health disorders.
Slowly but surely.
Exactly.
Ming, it's your turn.
So I think my words of encouragement would be very simple, like you're doing great, and whenever you doubt yourself, just know that there'll always be support, like hotlines, and you're not alone on the recovery journey. Actually, speaking of supporting words, right? Sometimes we think that whatever we said are helpful, but then it's actually not helpful. So like, actually, I want to pose a question to everyone that like, what are the things that you should avoid, especially when you want to encourage these people, actually. Yeah.
I think Mingy really brought up a good point. It's one of the topics that I have recently addressed this year in a different event itself is toxic positivity. So what is it, right? Is that whenever people trying to like share their journey or stories with us, right? On our side, most of us do not recognize that we are being a very bad listener. Some of us might think we are trying to think of a response back instead of really listening and hearing to that person. And be like, no lah. And examples of sentence of toxic positivity. So imagine you're like, oh, I'm very stressed with my assignment, this and that. And then someone, I mean, I can't blame the person or your friend because maybe they're not aware of it, right? And they just say things like, no lah, it's just a small thing only. You think you're the only one facing this issue. Everyone is facing this issue. No lah, you can do it. So in a sense, it sounds very encouraging, right? As a person someone you want to respond to, right? But for the other end, for the person who just shared their mental health journey or their sensitive stories, right? You are just dismissing their concerns, like everybody is facing the same issue. Why are you complaining about it? That's the underlying message. So what Mingy really brought was a very good point.
Yeah, I agree as well. For me, I hit the line when they say, chill lah, it's going to be fine. It's like, I know it's going to be fine, but I just want you to listen. And I absolutely agree. Every time someone says that to me, I feel like my feelings are being dismissed. It's like you're not even listening to how I actually feel. Your immediate response is just to give me, just to reply to me instead of listening. And sometimes we don't really want that. We don't want anyone to say anything. We just want them to listen. So I guess, conscious way of dealing with it is asking them ahead, how do you want me to deal with it? Do you want me to say something, or do you want me to just listen? I think that is some way that we could be assertive towards this scenario. And yes, I think I agree as well. There's a lot of words and things which I of course, whoever that says it don't mean it the way. But for us who is listening to it, and for us who's going through something, sometimes it makes us feel like we are being dismissed. So yes, I definitely agree.
Yeah, thank you, Mingy, for bringing such a meaningful topic to end our session here. And then I think there is 2 questions out in the Q&A Slido. So just give us a, yep. So the first question that says, do you think that technology is one of the cause of mental health problems?
I think I've said it a few times that it is, at least even if it's not a huge, it doesn't play a huge role, or maybe it does, but I definitely think that it does contribute. Like I said, social media, the toxicity in it, and like how much what's that right word? How much we are attached to it, how much we are so bothered about likes and comments and shares, and like TikTok, right? TikTok. I just got into TikTok like about a few weeks ago, and I realized that everyone is crazy about it because of the views, and people are constantly doing the most randomest thing, whether or not it is safe, whether or not it is ethical, whether or not it's environmentally friendly. They don't think about all of that just for the sake of getting the views. The amount of people who are doing all sorts of things is crazy, man. I think that that will definitely lead to some sort of mental health problems, and like that is just one example. There's so many other things like privacy breach and all those kind of things. That is also one of the aspects of technology being a reason to mental health causes. I myself, one of the reason of me getting out is because I think that my mental health would be better if I am out. So I can vouch for this. I think that it can cause mental health problems.
All right, thank you. And then now to Mingy.
Actually, as much as I agree that technology causes mental health problems, sometimes I wonder like whether it's actually a shift of mindset that we have to have in response to social media, because recently social media has played like a very big role in terms of like disseminating information for us. So we can't just like run away from social media and like reduce screen time. I mean, we can reduce screen time, but then we cannot run away from it. So I would like to explore the spectrum of like whether if it's that we have to adapt to it, and then we have to have a correct mindset in response to all this like information and negativity and stuff like that. So I think perhaps it's up to us as well in the digital age.
Thank you, Mingyu. Very well said. And then the follow-up questions will be, do you think social media is one of the reasons people faces mental health? Which I think Mingyu has already spoken about it. So we will skip this. And then the third question will be, do the introverts' personalities is related or caused by the mental illness?
All right, Choi, I hope don't run out of time. I think there's still enough time. So I'd like to readdress the two questions. I'm going to play the devil's advocate is that technology,
sure, no problem.
I'm going to play the devil's advocate for technology and social media. Technology does not cause mental health disorder because it's just technology. It's just technology. You can't really blame technology, but rather it's a social media issue. It's like how Facebook, they introduced the like concept. I think the issue of the like concept, I remember last time the dislike button, it really caused a huge issue in terms of social comparison. So yeah, just to be very short and simple, right? Social media is not the cause, but how, like what Mingy mentioned, how you think of those, how you use social media and all right, is really the factor. It's a factor, but it's not there's no direct causation factor. This is something I like to emphasize. There is no direct causation factor between technology, social media, and mental health issues. It is really, once again, how you emotionally regulate and how you approach social media and technology. And the third question is a very interesting question because it's a myth. We like to say, oh, shy people know that their mental health disorder is purely a myth. An introvert personality, right? Because I can be talking right now, but I can be introvert. So introvert and extrovert personalities it's not related or caused by mental illness, to answer this person's question. And interestingly enough, actually, recently I presented at the Asian Cognitive Behavior Therapy Association conference earlier this year, and a South Korean study found out that actually personality factors do play a role in how we are at risk of mental health disorder, or how we approach our life situations that may cause a trigger to mental health disorder. So extroverts, because regarding extrovert and introvert thing, right? Extroverts may during the COVID-19, interestingly enough, extroverts may be less at risk of developing mental disorders compared to introverts, even in this COVID-19 pandemic, because the key thing is the extroverts are more proactive in seeking social support. But once again, this is not generalizable to introverts and extrovert like personality dimension, because once again, it's a ruler, it's not a left-right kind of two things. So yeah, this question is a myth, and I hope everyone understands that your personality type does not cause or not 100% related to mental illnesses. Yeah, that's from me.
Thank you, Claris, for clearing up the myth. And then is anything, yeah, Mingy, it's your turn.
And I actually like to add up on the point that personality such as MBTI is like just a preference. That's what I learned from life skills module. So that's one of the important things that I learned from that. It's just a preference. And then like you cannot be just like trapped in the box of like, oh, I'm an introvert, I don't talk to people or stuff like that. Sometimes you're an introvert, but you can be doing like extroverted activities as well. So I think it's just a preference. Like you cannot just stick to the regulations and stuff like that. It's not like hard, like very like fixed. I would say it's quite flexible in a sense. Yeah.
All right, thank you. Sharu, is there anything you would like to add on to it?
No, I was just thinking how I don't think I was an extrovert a few years, like about 6-7 years ago as well. So I agree. Yeah, it's a preference. It's about how how you are at that phase of your life. Because I like about 6-7 years ago, I was very introverted in the sense that I wouldn't really voice out my opinions. I would rather keep my thoughts to myself, and I'm very quiet. Wherever I go, shy, I guess, if that's the right word. I was very introverted, and then I met the right people. I joined the right things. I exposed myself to a lot of and different type of environments that made me the person that I am today, which ticks off a lot of things in the extrovert spectrum. But like all both of you said, it's a preference. Maybe a few more years down the road, I might go back to being an introvert. So I guess it's just like the phase of life that you're at, and whether or not you are a certain way based on the life experience that you go through. So yeah, I really like that question.
All right, thank you. I think we can take one last question, which is, in your opinion, what can social media platforms do better to solve or to avoid causing mental health problems? And I think we can connect these two questions together. And what do you think of the whole Facebook whistleblower scandal?
Can someone clarify what happened? I'm not aware of this issue.
Same.
Yeah. Maybe someone who asked the second question can elaborate the Facebook whistleblower scandal down in the chat box below. And at the meantime, I think you guys can answer the first question first.
All right, then I'll just go straight away. So social media platforms, right? Let's talk about the design, like Facebook and Instagram perspective first before we go to the consumer side. So on their side, right, what they can do is start reducing the social comparison. Like I think Instagram really did a great job. I think now they remove the number of like features, like cannot see, right, something like that, right? And this is really a great step. Like it's solely they're finally like addressing this issue after since 2010 this issue has been here, but finally they're addressing that the social comparison issue is really the one of the biggest problems regarding social media platforms. But other than that, on the consumer side, right, it's just knowing how to stop or control your usage of social media. Once you start reading, because sometimes social media, right, the algorithm features, once you read negative news, suddenly negative, or once you read positive news, suddenly all positive. So recognize, right, that the continuous exposure of negative or maybe certain information, right, can really take a toll. And maybe you're not affected by one story, but repeatedly it keeps attacking your state of mind. Yeah, so once you realize that this is too much information that I can take off from these social media platforms, recognize it, stop the usage for what, regulate. This being a critical consumer that knows how to regulate your social media usage. And this is all for everyone here, including myself, who sometimes have like stuck on Instagram and viewing all these like negative information sometimes.
Yeah, and I think so both of you all did say about just now about how technology is not the reason for mental health problems. So yes, I agree. Technology is not the reason. Social media and the risk factors that they contribute is the reason to mental health problems. And like coming back to this, right? The only reason why I'm a computer science student, I'm obviously I am into the advancement of technology. In fact, I want to see more social media growings and different types of social media platforms coming into our lives. But like, what can social media platforms do? For instance, I think, of course, first of all, it is like the comparison factor that Claris said. And another thing is also like, I don't know, maybe they should introduce a usage time, because like, as much as, we say, okay, you know what, I'll control 1 hour a day, that's it. It's like, there is like a lot of like, obstacles, or like there's a lot of things stopping us from actually following our rule of like 1 hour a day, that's it. So I think iPhone has it, where you can set 1 hour Facebook, 1 hour Instagram, 1 hour Twitter, and then after that I won't be allowed to go into that platforms. So that is just iPhone. There's so many other different phone platforms, right? So I think that is something that the platform itself, Instagram itself, could come up with, and so that we could set it and say, okay, 1 hour a day, this is what I can do. And maybe we could even avoid topics like, okay, I don't want to read about all those kind of things. I don't want certain topics to appear because it's going to affect me. Those are like kind of simple things that could be encouraged in the platforms that could avoid us from going through some sort of mental health problems. Like for me itself, actually, coming back to me, right? For me itself, I think that the only reason why I want to go out, like Claris and Ming said, it is self-realization. So I feel like I've not come to that point where I realize and I want to act on it. I realize now, but it's very hard for me to act on it. So I want to get out of it, reflect on how I feel, and understand completely what I'm actually going through, and then of course come back, because I definitely promote the adapting to the advancement of technology. That's very, very important as humans, because technology is always going to advance. There's always going to be new things, whether or not it is inclined to your mental health, or you have to adapt to it and regulate it yourself. The only reason why I say I want to come out of it is so that I have the time to completely realize what is my problem, how I'm supposed to address it, how I'm supposed to reflect on it, and how it's going to make sure that I regulate my emotions while using these social media platforms. So that is my thoughts on it. So the whistleblower scandal.
Yeah,
you can't really click on it.
Sharu, I've just read up on the Facebook whistleblower scandal. So it basically is a whistleblower actually reports to the news outlet about a document being shared by a man named Hogan, and then the document actually is about Facebook spreading misinformation and conspiracy theories on their platform, particularly related to the 2020 US presidential election. Yep, so I guess it's more on how the public would take the validity of the how Facebook spread misinformations, and what do you all think that Facebook has to do with this, since it is actually becoming a more money-centric application rather than a social-centric application? Yep, do you all have anything to talk about it?
Okay, to the user, actually, I read about this issue this Sunday. I forgot. Thank you for reminding me of this issue. So I really love that whoever poses this question, like, brought this issue, right? Because, right, it brings up so many stakeholders' perspective. So there's, I think, 3 main stakeholders. The first stakeholder is Facebook as a business. When you run a business, you want profitability, and sometimes the dilemma comes between profit or ethics. And this time, Facebook really did take the profit side more than the ethical part lah. And on their side, well, I can't really say much to how Mark Zuckerberg was going to navigate this issue, but really lah, it's a matter of personal ethics lah. And in terms of legalities, I won't go in there because I'm not a law student. And the next thing is the second person will be the whistleblowers. Okay, throughout human history, especially, there's also one issue of document leakage in United Kingdom around the early 2000s. There's continuous document leakage, and I think back to the Trump presidency, there was the email leakage problem by Hillary Clinton as well. So from the perspective of whistleblowers, right, social media is a really powerful platform if you want to make a statement. And how you make the statement is really, so from the whistleblower side is a good move lah. But it's smart of them. Okay, it's not smart that the identity was discovered lah, but it's really a smart move from the whistleblower. See, social media is powerful in creating a sense of monopolization and dictatorship from Facebook side, but for the whistleblower side is a powerful platform for advocacy and like calling them straight to their face. And then for consumers, right, I just think the only thing for consumers what we can do, right, is just literally be a smart media literate person. That's all we can do from our side. But in terms of conspiracy theories and all, it's the algorithm. It's really the algorithm. And Facebook, well, I mean Facebook will not be hearing this, but honestly, they should or else like people is gonna come after them more and more soon. Yeah.
All right, thank you, Claris. Thank you, Sharon, and thank you, Mingy. We are coming to the end of our session, so thank you so much, all three of you, for being with us here today and for such an insightful sharing. Before we end, may we have a photo session with everyone else? So dear audience, please do turn on your camera for the photo session. Okay. All right, if everyone is ready, I'm going to initiate the 1, 2, 3. So 1, 2, 3, smile. The second one will be a freestyle one, so feel free to do whatever pose you want. And 1, 2, 3, smile. All right, thank you. Thank you so much. And then I will now pass it back to Asher, our moderator.
Okay, so it's a wrap for the first day of our Technophilia Summit, and we hope that all of you have managed to take something back from all the sessions today. And thank you so much for attending this summit as well. But before you leave, please scan the QR code and fill in the feedback form. And your efforts are very much appreciated. So if you guys have done it, you may leave. But do remember to join us tomorrow at 10 for a more technical session into the tech industry. So thank you once again for joining, and see you guys tomorrow. Have a good rest.